Welcome to our Frontline conversation with Mayor Muriel Bowser. We're delighted, we're thrilled to have you here with us, Mayor. Thank
Thanks,
you so
Doug.
much
Thanks
for
for
all your
having me.
leadership in the city and the region. And we have a lot of your fellow 2013 class members here from LGBT.
I noticed. It's great to see you living the dream.
They're doing a lot of shout outs to you. So that's great. If you have questions, please submit them in the Q&A section, and I'll try to get to them as best I can. So Mayor, let's just start off with how are you doing personally? How's your family? How are you weathering this? Are you getting enough sleep? How's that going?
I'm doing well, and I am getting enough sleep. It is one of the kind of biggest personal challenges, of course, is having to go out every day, essential chief communicator for the city, chief responder, but also manage my own anxiety about keeping my home safe. So that's one of the biggest things. This morning, I took my daughter to her 2-year-old appointment, and she's great. And we're just trying to figure out also how she will be able to reconnect to her grandparents, which is number one on our list. But we're doing well.
How about your office, the people that you work with on a daily basis? Are they all working from home, or how's that? Are they coming out?
Well, Doug, we have about, it's 37,000 people that work for DC government. We have about 60% of them on telework, and about 40% of them are reporting to their jobs. Police officers, firefighters, sanitation workers, and then there's a lot of my executive team that are reporting, Department of Health, Homeland Security, and others. So we still have thousands of people that are reporting to their offices every day. We basically switched and modified our government operations, so we're doing a lot online. So there's not as much face-to-face activity, but there's a lot going on. I am working now since about 2 months out of our Department of Health, which is our Emergency Operations Center. And that emergency operations policy group or executives that are helping me respond. We either report there or work from home, and I have some people that are going to their offices.
That's great. How, in the first couple of weeks of when this started, what was it like? How did you transition to that virtual environment for 60% of your employees?
Well, it remains, I think, one of the biggest feats of public administration that I've certainly encountered. How to look through 37,000 people, change their work status, make sure everybody gets paid, communicate it to the public, put that all on a website, and not drop the ball. And at the same time, make sure the most vulnerable people who can't make the transition to a virtual environment that work for us and that we serve, that we have options for them. And I can say, I feel pretty good that we got it almost all right going out of the gate. And we had the opportunity over several weeks, or for a couple of weeks really, to fix the things that we didn't get right.
And how's testing going for the public?
Well, it is ongoing, and we are shifting, I think, to what I call our reopen strategy. And I think that we'll have basically 3 waves of testing. The first wave was testing people who are sick and symptomatic and are in high-risk groups. They're healthcare workers, they're essential workers, and making sure that they have access to what at the time, going in the first few weeks of this, was very limited to supplies of testing materials. And now we're growing both the supply capacity in the places where sampling can happen. And the government has to be like a part of that. The idea at the end for testing is that it's ubiquitous, and you would get a test just like you would get a test at your doctor for anything else. And that's what we have to work to. But in this interim period, the government is supporting citywide testing sites. Next week, we'll roll out a downtown site because we know a lot of workers will be coming back, and we want to make sure that everybody in the city who needs a test gets a test, and that they're able to get one close to where they live or work, and that their results will get back fairly quickly.
So tomorrow is reopening in the city in phase one, and a lot of people will be coming back. I assume this is the toughest time you've ever had in your career in terms
It's
of
absolutely.
leading people through this.
Absolutely. It's the toughest. And I've had the occasion to talk to several DC mayors, my predecessors, and we all agree that not only is it the toughest time in an individual's leadership, but also for the city. This will be one of the biggest challenges that we have, where we have literally, we put our very robust rolling economy into a coma. By closing businesses and putting people on stay at home. We have over 100,000 DC workers who filed for unemployment. We have now almost 9,000 people who have tested positive for the coronavirus, in about 450 who've died. And so you have the health crisis, the economic crisis. But even having said all of that, it could be worse. And we blunted the curve. And while we reported 11% unemployment this week, which is 2 times as much as we had going into this pandemic, I saw reports from jurisdictions and states across the country where they're over 20% unemployment and growing. So we know we went into this strong. And if we get the health response right, we know that we can bring our economy back.
So what was it like making that decision to reopen? You set up a advisory group all across the city. It was very well done. And what was it like to say, okay, we're going to reopen, we're going to have people start to come back? I mean, what kind of
Sure.
your mind?
Well, the first thing that I think is important to say is when we talk about reopening, what this first order is, this first action is really stay at home light. So I lift the stay at home order, but we turn on very slowly other activity. So you can go out, I'm not telling our residents now to stay at home and only go out for essential business or to buy groceries. But I'm kind of saying only be very careful about where you go. Definitely don't go out in a big group, because we still prohibit gatherings for over 10. Be mindful of parties or gatherings that you're going to, how you're inviting people to your home. Be mindful of that. Be mindful of if you're going out to a restaurant, making sure that that restaurant is following appropriate social distancing and disinfecting and have testing protocols for their employees. Be mindful of all of those things. You can get a haircut by appointment, but also be mindful that your barber and salon owner are, they have the supplies that they need, and they're following the rules too. And what's important about saying all of that during phase one, and I haven't mentioned wearing a mask, which we should all be wearing a mask, is that if we do those things, we can get to phase two. If you want your kids to go back to school, do those things. If you want to be able to go to a large gathering in the fall, do those things. If we want access to our recreation facilities, we have to get this phase one right, and then we will be able to go into the other activities we want to do.
So not wearing the mask has become a pet peeve of mine. To protect other people, it's extraordinarily selfish that people saying, I don't need to wear a mask. When all you're doing by wearing is saying, I'm not going to give my germs to you, and not even do this. So it's very frustrating to watch what's happening around the country.
And it's so simple to do.
Shift a little bit to the budget, if we could.
Yeah.
Not details about your budget, but you're facing an enormous revenue shortfall coming up. The federal government, I thought, stiffed you all in terms of the aid in classifying you as a territory, not a state. So you've got what, $700 million you didn't get for that. And how are you? I know you submitted a budget. How are you planning to work through those shortfalls, and and keep services going. That's probably the toughest thing.
Right. And probably in the beginning, the first part of the pandemic, just before I had to declare a state of emergency, we were poised to submit a budget to the council. So we were almost finished with our budget. And state of emergency, cancel large gatherings, close businesses, close restaurants. So our revenues, the bottom fell out of our revenues in this fiscal year. Our fiscal year runs through September 30th. So we had a revenue loss of 700 million. And for this year that we had to solve for with 5 months. And we have a revenue loss for next year, which was the budget that I was working on for 21, of over $700 million. So we had to solve for that. Now in DC, we're different than a lot of places. Our budget, we budget for 4 years. So we budget for the next year plus 3 years, and it all has to balance. So that was tough, but we went into it with certain values. We didn't want to cut services for DC residents. We wanted to invest in our schools, the growth of our schools. We know our kids are coming back to school and we don't want to go backwards one iota. We wanted to keep our team in place as best that we could. So if we could avoid layoffs and rifts, we would. And we wanted to make a responsible and judicious use of our reserves that we built up over 10 years that are meant to be used for a rainy day. And we did all of those things. So we tapped some reserve. We slowed down the growth of programs and hiring. And we also asked our employees to make some sacrifices, especially for next year, where I held pay. And we won't see any pay increases, but we won't see any massive job loss.
So one thing that's been frustrating to me is in Montgomery County, when I had to deal with a crisis, excuse me, the federal government was right there for you. They came and they were there. The sniper shootings, we had the Swiss Marshal. Now the feds are saying, kind of, you're on your own. It's been very frustrating about that. How do you deal with that when the president's living next door?
It's very strange. I mean, I don't know anybody who thinks that this would not be, but it's not the job of the federal government to marshal limited resources. States fighting against each other for masks or ventilators, that's absurd. And not only are we fighting against each other, but fighting against the world. This is a global health crisis. So getting all of these materials and amping up our systems to be able to do these types of procurements. We have a great procurement system. So I think that we stepped up to the challenge, but that's quite unusual. Being able to get information out about limiting travel, that's the job of the federal government. We shouldn't be left to figure that out on our own. And I think, quite frankly, they could be more helpful with testing strategies and supplies around testing. If we had all the supplies we need, and that includes PPE for testing, I think that the numbers of tests and our ability to isolate and stop the spread of the virus could have been more aggressive and effective earlier.
So they're leaving you on your own in a lot of ways, which I find very frustrating. How has the cooperation been between Montgomery, Prince George's, Fairfax, Arlington, Alexandria? So the regional and the state cooperation that you've seen, it seems to be going very well.
Well, I think that with Governor Hogan and Northam and I, we talked frequently and early, which I think was good because so much of the way their states go, they don't always like to say this, but this region drives a lot for the entire state of Maryland and the entire state of Virginia. So what happens in the National Capital Region and the counties that surround the district that make it up is hugely important for those states. And I think that you're seeing a little push and pull right now between the counties and their state houses, which is appropriate, because unlike us, the counties don't necessarily have all of the functions of government to respond to a crisis. So the state and the counties have to work together.
So how about something that I've learned in a crisis is that at some point people turn on you, whether it's a snowstorm, whatever. They just say, enough's enough, I've had it. We haven't seen a lot. We've seen some horrible situations around the country. We haven't seen a lot of that here, a little bit of it here. Any sense of dealing with that, or
well, I will say early on when we had to order restaurants and bars closed, I had a restaurant, and this is probably I don't know that I appreciated it at the time, but we had a restaurant group stand up and say, you know, forget that, we're not doing that. What are you talking about? You're crazy. And the response from the public was so swift and immediate in telling that person that they were going to follow the orders, just like everybody was going to follow the orders, and that was going to keep us safe. And I have been struck by the spirit of Washingtonians throughout this to say, listen, as long as you tell us everything you know, when you know it, and how you're responding, and it makes sense to us, and you'll communicate to us all the time, then we're proud of the work that you're doing and saying that you're putting the data first and our health first, and that we trust that you're going to do what's right to bring our economy back and get people back to work.
And I think that the word trust is key there.
It's very key. Yes.
They trust you, you can do a lot. They'll listen to you and they'll work with you and give you time to solve these problems. Now, the other question was, this is brand new for you. Dealing with this is new for everybody.
Right.
New for you. How are you making decisions? Who do you rely on? I know, again, just to mention the sniper shootings. During that time, I had people who worked for me. I had people who were sort of interested in their own special interest schools, whatever. It was really hard to say, okay, who's looking out for the best interest? Who doesn't have sort of a case to push or a cause to push here? How are you getting that kind of advice that you can trust is somebody who's just looking after your best interests?
Well, I definitely have a tremendous team. Our Department of Health is doing an incredible job. I actually think that our DC Health Director, this is her sweet spot. And I think that it's kind of strange to say it this way, but it's been her leadership and expertise has been on full display for the residents of the District of Columbia. And not only have I fully appreciate her ability to synthesize all this information and give us good advice, but also the team there of epidemiologists and statisticians and just public health people are, doing an incredible job. But it's not just health in a health crisis that we're dealing with. So early on, kind of public administration wonkiness, we kind of sat down and just totally redid our organizational chart and realized that this response to this crisis was going to be so all-encompassing that it was the prominent way we would be organized and operate. And then all of our other operations of our government, we had to kind of sit some other people and focus on the other government operations. So that's how we have approached it. And so we put together a policy team that is there to give me advice. We meet daily, twice a day, 8 a.m. first thing in the morning, and again in the afternoon, to make sure we're all situationally aware. But I also thought, Doug, I was well served by putting together the Reopen Committee. A lot of LGW members served on various committees for Reopen, because that got us out of our little world at DOH to make sure we were hearing constantly from other people. In that process, not only did we have 11 committees with at least 10 people on each committee, we did 100 in-depth interviews and focus groups to really listen to our residents and business community. So that became another group. We were also very fortunate that Susan Rice and Michael Chertoff, who have incredible global experience, were willing to serve. And they didn't take it as an honorific assignment, that they really rolled up their sleeves and got to work. And I think actually even raised our execution to another level. So those have been a lot of the feedback and how I've been making decisions. But the thing that I've missed, and part of kind of being on limiting my movement. So I'm home, I go to the office, come back home, is talking to people. And you know this well, that out of all of these great people that are around us that are giving me advice, sometimes the best advice you'll get from the man or the woman on the street. And so over the last couple of weeks, I've stepped up and had a few more public appearances where I can get that feedback. We've been doing telephone town halls where I get that feedback as well. So a lot of different places, but at the end of the day, I have to make the decisions, and I have felt that I've been well served by the advice that I've gotten.
Well, it is so, as you said, it's so important to get that person off the street feedback of how you're doing.
Yep.
But your committee, the reopening task force, really, that's impressive. All those people involved. You heard from a lot of different voices there. That helped you quite a bit, and
Yep.
it shows in their product, and it shows in
Yep.
what they came up
Thank
with
you.
and how you're implementing that. So
Thank you.
let me turn to some of the questions here. People are getting a little antsy.
Okay, my
I have a
pleasure.
handful of questions. Well, from Mary Abjay, what was your biggest leadership lesson so far during this?
I mean, I think there have been a lot, Mary. I think one of the things, and you'll appreciate this, is our decision to hold really in-depth public briefings regularly. When we started out, we were doing them every day. Now I'm doing a public briefing an hour. I mean, I answer every press question Mondays, Wednesdays, and Fridays. And on Tuesdays, I'm doing some national press. And so that is a lot of work for my team. They're putting together stats. They're making it visually appealing. They have, a setup that's great, all while social distancing and trying to keep themselves healthy. And so that has probably been my biggest leadership lesson, that really leaning in on the communications and telling people in a consistent way what we know and how we're going to get through this has enabled us, I think, to keep people with us and keep people following the executive orders. One thing I heard Andrew Cuomo say recently is like, we can put out all the orders we want, but it's 700,000 people. I can't make everybody stay in the house. There's no way to enforce it. So it's self-enforcing. People enforce it for themselves, and they make those decisions because they have quality information.
Getting those communications right is key.
Yeah.
In terms of keeping that trust from the public, and sometimes you can give. I'm glad you're scaling back a little bit. Sometimes you can give too much information. You can be too available, and it just confuses people. It worries them or makes them fearful a little more than they should be. So
right.
We have a question from John Joaquin. The 40th anniversary of the 930 Club's coming up. When do you expect arts venues like that to reopen?
Well, we are looking at the recommendations from the committee, and certainly large venues and gatherings are one of the most difficult things to bring back. They were the first to close, and they'll likely be among the last to open. So we will continue to follow what the virus is doing in our city and move through our phases. And I think we contemplate a phase 3 opening for large venues.
With the vaccine, or?
There is some question about when we're going to have a vaccine, but I think the big thing is what and when can larger and how many people can large venues accommodate with appropriate social distancing. And so I think that's kind of our focus.
So Joe Gardermall's got a question about, a similar question about offices and looking at when offices can reopen and people getting back to work. And I know different companies are phasing in things, that they're handling things a little bit differently.
Right. So we, offices can open. There's no, we don't have a prohibition for you going into your office. Non-essential businesses that are retailers, we're allowing for curbside pickup. What we do discourage going back to normal. So if your folks can telework, they should telework. And I kind of use ourselves as an example. We are a little bit different. We provide front-facing services, face-to-face services. So there's some things the government has to do, but you can go in if you have people that have to be in the office. But we encourage telework, and we're probably largely going to encourage telework through. As long as we can, to be honest with you, because bringing people back to their offices, using transit, going to restaurants, this does not contain the spread of the virus. This is one of the biggest things that will keep the virus going.
Natalie Randolph's got a question on schools and parents. And if parents have to go back to work and the schools aren't in, or the daycare is not available, is there any kind of support there for those people?
Well, we recognize that there are these enablers that enable the economy to get back, and one of them is making sure that kids are taken care of. We are working now on more daycare opportunities in the district. I know the same is happening in Maryland, and I assume the same is happening in the district, so that we're getting daycare back. We believe that schools are going to be modified for a while, and that means that we want in-person learning in the fall, but it is likely to be on modified schedules. So our team right now, and I expect to hear some recommendations on how we talk between the business community and government about what that means for work schedules. And if there is any kind of synergies that the government as a convener can help achieve.
So we're hearing from some businesses that as they start to reopen, they're saying, if you've got young children at home, keep teleworking. If you're over 65, keep teleworking, don't come into the office. So their businesses, I hope, will be flexible enough to help with this as well. So.
Yep.
So Glenn Howard has a question of enforcement of your phased reopening, and how do we make sure that it doesn't lead to another wave of infection like we saw at the Ocean City Boardwalk the other day, which was a nightmare.
Right. And enforcement is tricky. It's a very tricky issue, as I mentioned before, because one of the comments that came out of reopen is that the police find it very difficult to be the only people in society that are enforcing orders as it relates to social distancing. So one thing that we are thinking about are other ways that we can recruit ambassadors to help with social distancing, and ambassadors who are close to communities. So we actually have a solicitation out now for nonprofits to work with us to help us spread the word about social distancing, testing, isolation for people who test positive, and help be those ambassadors.
We've got a great story. One of our members was on one of our Lunch at Your Laptop events and said she was going with CVS in the district, and there were two young men who were just arguing about masks and wearing them and didn't want to wear them. And she said, I just walked up to him and said, pretend I'm your mother. Either put on the mask or go home. And she said they just put on the mask and went in the store and everybody.
Yes, and sometimes that's what you
great.
need. You don't need, if it was the police officer doing it, then you could have a big fight. And sometimes we have to get people who are, are credible to each other.
So we've got a shout out thank you from Lupe Quinteros Grady about your summer youth employment program and keeping that moving. She's very thankful for that.
Thank you.
Her constituency as well. You mentioned that you have a hybrid situation with the schools. What are some of those options that you're looking at?
Well, one option is we'd hope, to be honest with you, Doug, that we would be able to have in-person summer school. I pushed my team really hard, and we just don't think that the health conditions will allow that. So we're going to have virtual summer school. We'll be able to serve, I think, about 4,000 kids, and really try to keep them engaged and prevent learning loss over the summer. We are also going to have an option to start school early, a summer bridge for about 11,000 kids. And those kids will be in the transition years, 3, 6, and 9th grade. So that's about 11,500 kids. And then our normal school year will start on August 31st. And our education team is thinking about a few options. First, how would we accommodate parents who don't want to send their kid to school in person or can't send their kid to school in person? The kid may have some pre-existing conditions and parents can't send them. And another group that thinks that they want to do a little bit of both. And then the third group is the modified schedule. If to appropriately social distance kids, will we split them up between an A group and a B group? And the A group goes to school 3 days, the B group 2 days, and they switch for the next week. And so those are some of the options that we're considering. Actually, tomorrow, we're going to launch a survey for DC parents to weigh in on those different schedules, and we'll make some decisions from there.
So Dara Donnell is asking about, will those decisions apply to the charter schools as well, and how are you working with the universities in the district for their reopening?
Yes. So another interesting leadership challenge or opportunity has been speaking with one public education voice. For everybody's information, we have one of the largest public charter sectors anywhere in the nation. So we're dealing with literally, I don't even number the number of LEAs, like 70 different local education agencies that can make decisions about their schedules. So what we've heard from parents, however, is that they want one voice around public education when it comes to these type of health decisions. So we continue to work with our public charter school leaders to get their buy-in to what we think works best for the district, and I strongly encourage them to follow what DCPS will do at the end of the day.
And Maria Rodriguez wants to know, all of those recommendations you got from your reopening committee, are you following them, or are you making adjustments to them, or how are you?
We will. They are recommendations. They don't have the force of guidance or policy or executive order or law. And how I will operationalize them is through executive order by phase. So yesterday I issued a phase 1 executive order. I expect that there will be some things that we do differently, and there may be some things that have been recommended there that the health data overtakes or some other event overtakes. So I expect that there will be some differences.
John Jacob gives a shout out thanking you for your leadership, and
thank you
for being with us today. We're all appreciative of that. Are we going to have a July 4th like we did Memorial Day, where it's just in your own backyard or your own side yard with no mass gatherings or any gatherings? Are you going to do fireworks?
We are not going to issue any parade permits for the 4th of July. We expect that we won't be issuing any through the public health emergency. And my current public health emergency runs through July 24th. And, you know, there's some administrative things to why we have public health emergency. So we could be in that for a while.
Kathy Guy wants to know about masks. Is it a requirement to wear them? What are the requirements for that? How do you enforce that?
We have requirements for going into our businesses, around our businesses, a whole list of things you're required to wear a mask to do. But generally speaking, if you cannot social distance, be 6 feet from another person, you're required to wear a mask. Mask enforcement, public mask enforcement is virtually impossible. And the way that we achieve it, and we're thinking through this now, is with public education. We also, our businesses, however, can enforce and will enforce the mask requirement when you're going into a business, a grocery store, going to a restaurant, you know, going back and forth to the bathroom, for example, you need a mask. Eating your hamburger, you can't wear a mask. I mean, so there's some commonsensical things, but I think that this is a change that we as neighbors are going to have to promote and enforce in our circles.
Maria Hangerson asks, do you envision going back to more decentralized specialty health clinics in hard-hit areas for prenatal, maternal health, and general health screening after the pandemic?
Do I think we will go back?
Back to more decentralized, having more health clinics in the neighborhoods to do some of that.
Well, we rely quite a lot on our community-based health organizations. In fact, we are relying on them right now to do testing. And many of them have received federal funds to help respond to COVID, and they are participating in our testing strategy. So yes, we need all of our community-based health organizations, not only involved in COVID response, but involved in keeping people healthy.
And Steve Manlove wants to know how you're staying so positive during these times.
Well, I've had my moments, I will say, and I started to say earlier, I was really sad early on in this because even before people really started getting sick and we were experiencing deaths, like I was really sad about my budget and all of the things that we wouldn't be able to do that we had planned to do. Was very sad about all of our businesses closing, thriving businesses that have done nothing wrong, that just got shut down and had to let go of their employees. And then we started to see just the toll and the anxiety that so many people were experiencing. So I think I felt very, I've experienced all of the stages already. And I actually feel energized by the opportunity to bring us through this, the crisis at hand, but also for the comeback.
And Denise Hart asks, what are the plans for non-retail businesses when reopening? Do the offices need to be disinfected? Who sets those guidelines? Do the employers need to disinfect regularly in addition to normal cleaning?
Right.
What are some of the things that you're going to have to do as a business owner in an office to get it ready?
Sure. So we're going to plan to get out some more guidance. And a lot of big organizations have done some already. The CDC has some guidance. I thought the architect of the Capitol put out some very detailed guidance for the Congress, for example, that we've referred to. DC government is working on a come back to work guide, which is one thing that we are going to use to give other businesses some guidance and advice as well. And I think a number of the associations are going to put together some guidance for their members, be they commercial office buildings, apartment building owners. Will also have some recommendations about cleaning protocols and schedules. So those things will be forthcoming.
So we've got about 5 minutes left with you. George Williams asked, any inspiring stories that you've witnessed or seen? I mean, what out there has inspired you during these couple months?
Oh, I just think it's been so much. I've just been really inspired by my team rolling up their sleeves and getting to work and not daunted by the fact that this virus is circulating, and just coming to work puts them at risk. And I'm inspired by what they're doing every day to help me communicate to people, to have very sophisticated modeling and data analysis. I'm just inspired by that work, by their work.
And Sherry Werb and several others asked, what can we do to help you other than following the guidelines?
Oh, I think that we are all, I'm always listening to ideas. And I think, and sometimes people, if you read something, you had a colleague from another city call you with an idea that you think would work, and can help the district, please share it with us. Because I think our focus really has to be on how we get our economy back, get people back to work, and see ourselves differently on the other side of this. I don't think that we have fully appreciated yet how we could do things differently. And I think a lot of people have kind of changed their thinking. I've changed. I had no idea that we could operate in a virtual environment as well as we have for as long as we've have. I had no idea about that. I love the fact that you can drive anywhere in DC right now in 15 minutes instead of 45 minutes. So like, how do we transform how we travel coming back? I think there's some opportunities to do that. I think there have been some struggles with distance learning, but I also think that some of our education leaders have also seen things that work better in distance learning. For one, I've had cabinet meetings on these video calls. I thought that would be horrible, but in some ways it's more intimate because I'm right in front of my director. If we were in a room, would have been 6 rows back. I mean, so I just think there are all kinds of things that I've learned from this process, and that we're learning as a city from this process, that we can do totally differently.
Do you have any LGW stories for us? Any LGW members or Line Trust or your classmates that have reached out to you during this time or helped you during this time at all?
Well, I will say my classmates always reach out to me, and they are a great source of inspiration. They're so incredibly smart. And I know that Perry Pigeon Hooks participated in one of our committees. Jody Ofka, I think Adam Weirs has been on these committees, and they all told me how much work it was. So maybe next time they won't answer the call, but it was a lot of work and a lot of diverse views and opinions. But also what LGW members are everywhere, as we know. And sometimes that ear to the ground that you have may be a voice that I need to hear. So please keep those ideas and recommendations and feedback, good and bad, constructive criticism is welcome too, because as you said from the beginning, we've never done this before, and we want to get it right.
So Mayor, thank you very much for your
Thanks,
time.
Doug.
With the time limit, I just want to thank you and say we've got a lot more questions here. We could take hours of your time. We're not going to do that. But any final words you want to give us as we leave?
No, I would just tell everybody, and you asked why I was optimistic. I'm optimistic because we all in this whole region went into this strong, in a good position. Our fundamentals are good here. And we have to stay focused on our vulnerable populations. We have a special responsibility to do that because of how strong we are. And if we're able to invest in those populations and protect them through this crisis, we'll come back, and we're going to come back stronger than ever.
Mayor, thank you so much. This
Thank
is
you.
wonderful. This is great. Thank you.
Thank you.
Have a great day, everybody. Thank you.